This is Sleep Better TV. I'm Scott Drake. My guest, we welcome back Dr. Catherine McGregor with Lyndhurst Dental and the TMJ and Sleep Center in Eastern Ontario, Canada. In this segment, we're talking about pediatric sleep disorders, and I'm guessing you probably aren't aware that kids can have a sleep disorder. Dr. McGregor, welcome. Talk about diagnosing and the treatment of children with sleep problems.
It's actually very common, and we're seeing an increase in children that present with a medical history of ADD or ADHD. A lot of children are today being diagnosed as having this attention deficit hyperactivity syndrome, when in fact those children are most commonly children that are not sleeping properly. If an adult has poor sleep, the adult tends to exhibit some daytime sleepiness. When children have poor sleep, they tend to exhibit what we often called an overtiredness, which results in the child being fussy, cranky, irritable, not behaving properly, moody. So the ways that some patients or some parents will begin to become concerned will be that their bedroom might be down the hall from their child's, but they can hear loud snoring from their child. They can hear loud tooth grinding. They might say that their child is performing poorly in school. They might tell us that although their child is 6, 8, 10, their child is still having bedwetting problems. It's a social problem for the child. The child has a hard time going to sleepovers. If you are in the stores today, you'll see large sizes of diapers for kids. It's indicative of a widespread problem. When the child presents in the dental office, these are children that are really nice kids, but when they sit in the chair, they have a very hard time tolerating something as simple as a dental mirror in their mouth. They have a very difficult time with cleanings. And now we can see that it's because they're having a difficult time breathing. So they're actually choking a little bit, or they're afraid they're choking when we introduce the mirror or some polishing, because they often have large tonsils or adenoids and they just can't breathe properly. Some of these children have a nasal obstruction from large adenoids and they can't breathe that way either. We stress to parents when a child presents and they've been diagnosed as having ADHD and they're on very severe, very serious medications that are actually high stimulants. These children often then need a second prescription medication, a sedative, to get to sleep. That's not normal, and perhaps the why of the question hasn't been asked. And on examining these children, very often they present with large tonsils and adenoids, and we'll make a referral to ear, nose, and throat to have that addressed. Some children do need to have some surgical intervention. Other children need to have some orthodontic therapy to widen the palate and drop the nasal airway and actually create a better airway. So in looking at the why of the problem, it's often a lack of a proper airway, a lack of proper sleep that can contribute to a pediatric sleep disorder. Untreated pediatric sleep disorders can lead to children socially becoming misfits, children not performing up to their academic potential, children unfairly being labeled as just, nasty kids or troublemakers, children that, if they're not diagnosed, it could set them down a really unpleasant course in life. So very, very important to look at these children and do an adequate examination and adequate diagnosis, identify any sleep breathing disorders. If they're not treated at this age, these are the people that will turn into adults with often severe sleep apnea and severe health problems. So it's, I would say, one of the most important things that a dentist can do to pick up a child early on and help that child be properly diagnosed and properly treated, because you're actually changing that child's life.
All right, Dr. McGregor, thank you so much.
You're welcome.
She is Dr. Catherine McGregor with Lyndhurst Dental and the TMJ and Sleep Center in Eastern Ontario, Canada, and she is an expert here on Sleep Better TV.